Hi, it's Dr. Isom. I'm here to give you the second part of Chapter 17, Personality Disorders lecture. In the first lecture, I went over the definition of personality disorders, the characteristics that personality disorders have, the two characteristics that all personality disorders share, and I introduced the idea of all of the personality disorders and three clusters in which they're arranged. Now, you will not need to remember which personality disorder falls in each cluster. I just present them here because that is the way they're presented in the DSM, and I want you to be familiar with that organization. I will discuss them in order, though, starting with Cluster A. The first personality disorder in Cluster A is paranoid personality disorder. Paranoid personality disorder is characterized by having extreme suspicion and fear of betrayal for other people, along with resentment and a high level of hostility. The person with this personality disorder just generally assumes the worst of everybody and is constantly alert for those signs of betrayal. This is something that tends to be more common in women, but one of the famous people who is thought to have had it was President Nixon. In fact, President Nixon was so paranoid that he insisted on taping every meeting, everything anybody said in the Oval Office, which ironically was the thing that produced his assumed guilt and eventually led to his resigning from office to avoid being impeached. There is an example of a therapy session of somebody with paranoid personality disorder. If you're interested in hearing that, go ahead and click on the link in the PowerPoints. This is about 5% of the population, or thought to be about 5% of the population. Remember, the overall percentage of the population that's thought to have personality disorders, at least one anyway, is 15%. So 15 out of every 100 people is thought to have at least one of these personality disorders. The next one is the Schizoid personality disorder. Now, this one and the next one, Schizotypal, have similar sounding names, but they're very different. And I'll tell you what the main difference is when I get to Schizotypal. So, Schizoid, this is somebody who has really no desire of interacting socially, intimately with other people. They have an indifference to wanting to be around people, this cold or bland kind of style of behavior. And in addition to that, they experience really flat affect. They don't have strong emotions at all. And they definitely don't experience a lot of enjoyment in social interaction. And they're also indifferent to people's praise or criticism. They don't really care what people think of them. They don't really feel that much emotion at all. There is an interesting video. I highly recommend it. Go to my website, and there is a video that was created by a man with this personality disorder, and he purposely created it in black and white to kind of emphasize how he sees the world in really shades of gray. He doesn't experience strong emotions, and he doesn't really care about much. That was his message. So the person with schizoid, they're more interested in doing things on their own. It's thought that Belle, the character of Belle in Beauty and the Beast, might be somebody who could be diagnosed with this because she really didn't want to interact with people. And in addition to that, she had some kind of odd ideas, and she preferred to interact with the animated characters, you know, the teacup and the teapot in the movie rather than with people. So the things that characterize this personality disorder are indifference to other people, really flattened affect. They don't experience a lot of positive or negative affect, and they prefer to be alone. This is equally common in men and women, and it's thought to be about 3% of the population. This is characterized as a long-standing pattern of detachment from social relationships for this person. Okay, the one that has a similar sounding name that is very different is schizotypal or schizotypal personality disorder. This person is characterized by having really kind of weird, quirky thoughts and ideas. Their behavior is unconventional. They may dress unconventionally. They may even sound a little bit paranoid. They may talk about conspiracy theory. They may have superstitious beliefs. They do have difficulty in close relationships, but it's not because they don't care or they don't want a close relationship. They want that emotional intimacy with others, but they have a lot of anxiety about it. And that prevents them from being able to express themselves and to experience interpersonal relationships. So they have a hard time with it. They may have odd thoughts or speech patterns. Two fictional portrayals are Ace Ventura, Pet Detective. There's a funny clip of him. Willy Wonka in the Charlie and the Chocolate Factory movie, he displays symptoms of somebody with schizotypal personality disorder. And then Cosmo Kramer, he was just an odd guy. He is somebody that might qualify as having schizotypal personality disorder. Again, the thing that makes this different from schizoid is that people with schizotypal personality disorder, they're odd, they behave strangely sometimes, but they really want to have close relationships and emotional intimacy with others. The schizoid, let me go back to them really quick here. The schizoid personality disordered person, the thing I like to say is that schizoids are void of any desire for social interaction. Okay, so schizoid, they don't want to have emotional or intimate relationships or friendships with people. They would rather be by themselves. They get no pleasure from socially interacting. Whereas the schizotypal, they really want to have those relationships. They're just a little off in terms of the way they think and they dress and they behave. And they feel a lot of anxiety when they experience interacting with others. And so that is something that gets in the way of their social relationships. The prevalence here is up to about 5% of the population, anywhere from just a little over 0.5% up to 5%. The next one in cluster A is the histrionic personality disorder. And this is your attention-getting, need to be the center of attention person. They often express dramatic opinions or emotions. And then when you ask them, for example, why they are expressing that opinion, why do they feel that way? They really don't have any reason for expressing that opinion. They just want to be the center of attention. And they don't feel emotions very deeply. It's kind of a shallow expression of emotion. They just want to express those strong opinions so that people will pay attention to them. Sometimes they'll dress provocatively to get that attention. That's why I like to include Austin Powers again. If you saw the movie Mean Girls, you can recognize the histrionic personality disorder in Regina George. She would do anything she needed to do to be the center of attention. Maybe you recognize this guy on the right. His name is Richard Simmons, and he was a really famous fitness instructor in the last century, and he became really famous because of his enthusiasm. He was just very enthusiastic and dramatic, and he used a lot of humor and funny actions to get the attention of people, and he made a successful career in fitness. You can see his outfit. It's definitely designed to be the center of attention. This is about 2 to 3% of the population. It's equally common in men and women, but it looks different. In women, it can be the mean girl, it can be the drama queen, and in men, it can be more sexualized, more sexual provocativeness. Got some clips, if you're interested, of Austin Powers showing off that sexual provocativeness. And then there is a clip showing Regina George and some of her behaviors that are consistent with histrionic personality disorder. The next one, going to the next cluster, is narcissistic personality disorder. And this is this pervasive belief that the person who has this disorder is superior to everyone else, deserves special treatment, feels entitled to that special treatment. In fact, only really wants to associate with people who they feel are special. They're very arrogant and they don't have any problem exploiting other people for their benefit. One of the characteristics of this disorder is a notable lack of empathy. There's just really no ability to understand what it would feel like to be somebody else, or what it would be like to experience the feelings of somebody else. Some famous leaders that have been thought to have this narcissistic personality disorder are Hitler, Mussolini, and Stalin. They just had a very callous, exploitative style, and they didn't mind who they killed or stepped on to get that special treatment and to feel superior. Charles Manson was somebody who was diagnosed with narcissistic personality disorder, definitely had a sense of entitlement, thought the rules did not apply to him, was very envious of great things that other people had in terms of wealth, prestige. One of the things that can clue you into whether someone is very narcissistic or not is how they respond to criticism. People with narcissistic personality disorder are extremely sensitive to criticism, and when they are criticized, they viciously and brutally attack whoever the person is that criticized them. And this is thought to reflect, ironically, very low self-esteem, because people with higher levels of self-esteem are less sensitive to people's criticism to them. So even though people with narcissistic personality disorder come off as arrogant and confident and entitled and feeling special, it's really thought that their self-esteem is very, very low, and that's why when they are criticized, they viciously attack whoever it is. This is thought to be one of those personality disorders that is almost impossible to treat, very difficult, because It's one of those disorders that is egocentric. The person with narcissistic personality disorder doesn't really realize that they have a problem. In fact, the problem is with everybody else. This is thought to be less than 1% of our population, predominantly in males. So I also have included here a few clips. The one on Charles Manson is kind of frightening to hear the way he talks, but it really illustrates these symptoms. And the one, How to Spot a Narcissist, it's kind of a cute, humorous thing. But I encourage you to get a better understanding. Go ahead and click on the links in this PowerPoint because they illustrate some of these symptoms of personality disorders. The next one is antisocial personality disorder. They do illegal things. They're impulsive. They engage in risky behaviors like illicit drug use and things like speeding. They are also noted for their lack of empathy. It doesn't even occur to them how their behaviors could affect somebody else, particularly if those behaviors were hurtful. And actually, what's believed about them based on the research is they understand cognitively that this might hurt somebody, but they are not able to feel that. They're not able to experience that. They don't have that somatic marker, as Antonio Damasio would say. One of the things that they say about people who have antisocial personality disorder is that they know the words, but not the music. They know exactly what to say to get you to do what they want. But when you experience the negative consequences of that, whether it's physical pain or emotional pain, they could care less because they can't share in that experience. They don't know what that's like. Other characteristics are, as I was saying, they are often irritable, aggressive, irresponsible. When they cause problems for other people, they don't care, and they don't have any problem being deceitful, lying, manipulating, or hurting other people to get what they want. So this guy here on the left is a guy named Bernie Madoff. I don't know if he looks familiar to you, but he would qualify as having this disorder, even though he never hurt anybody physically, at least not that has been reported. But he developed a Ponzi scheme that swindled people out of their life savings, millions and millions of dollars. And he had no problem doing it. He didn't mind lying and being deceitful. He's in jail. Unfortunately, a lot of people are out their life savings as a result. On the other hand, next to him, we have Ted Bundy, who also would qualify with antisocial personality disorder, but he is the violent, deceptive, and deceitful person. He was involved in a number of rapes of college women and murders. He was a very charming guy, and that's something that is consistent about people with antisocial personality disorder. I studied them in graduate school. We'd also call them psychopaths. They can often be very charming and witty and can get you to do things that you thought that you would never do. Not that I've done that, but I know from stories that they can talk you into anything and they don't feel one bit of remorse or guilt or anything, even though you might do something that caused you great harm or something that caused punishment. I know that prison guards have often gotten in trouble for things that they've been talked into by psychopathic or antisocial personality disordered prisoners. This is more common in men, and it declines with age. Once men get into their mid-50s, you see a dramatic drop in antisocial personality disordered behavior. And perhaps that has something to do with testosterone. We learned in chapter 8 on the anatomy and physiology of personality that high levels of testosterone are associated with aggressive behavior, dominant behavior. So there might be a connection there. The prevalence for this is thought to be about 3.5% of the population. And like I said, it's mostly men. It's more rare to have a female with antisocial personality disorder. This is also one of those disorders, not only is it egocentric, so people who have this disorder don't realize that there's a problem with their behavior. They think everyone else is the problem. But this is one of those that we really do not have any sort of treatment or cure for. We just don't have that. And it may be related to early attachment relationships or the failure to develop attachment relationships. There's lots of speculation as to what causes it. There's some interesting clips if you would like to explore that. Ted Bundy, it's a dramatization of the way that he interacted with people, and it just shows his charmingness, and it also shows his cold callousness over the crimes that he committed. The second one, Latarian Milton, I don't know what he's doing these days, but this is a video of a little boy who committed a lot of crime, and It just shows you what antisocial personality disorder might look as it's developing in a child. Same thing with the bottom one, the 13-year-old boy with over 100 felonies. There's a psychologist in there that says something she really shouldn't have said. It's unethical, but it is a little bit comical. Anyway, those clips illustrate the symptoms of antisocial personality disorder if you're interested in seeing them, and I recommend, if you have time, that you should do that. The next one in the cluster is borderline personality disorder. I mentioned this one before about how it's because of the clinical impression diagnosis. Two people with borderline personality disorder may look completely different in terms of their symptomology, but this is the most severe personality disorder. And the hallmark symptom of this one is something called emotional dysregulation. So an inability to control a person's emotions. So they might fly into a violent rage. They might fly into a rage that's directed towards themselves and engage in cutting behavior. They have a fear of abandonment and chronic emptiness. And so they just have a really hard time functioning because they don't feel a sense of wholeness. They have a difficult time with emotional relationships because they constantly fear they're going to be abandoned. And they have a hard time knowing where they end and another person picks up. So they have a hard time with boundaries, and that's referred to as an identity disturbance. They find interpersonal relationships difficult and chaotic, and they are unpredictable in the way that they respond. But again, their emotional responsiveness is unstable, and that is really the hallmark symptom, and that's emotional dysregulation. They have a really hard time regulating their emotions. One of the things that happens too is that people with borderline personality disorder think about things as either black or white, and we call that splitting. So I have this little picture here that shows normal thinking. You can make a judgment of something, can have many different characteristics. It can be somewhat bad, somewhat good, but there are lots of shades of whether, something is a good thing or a bad thing. However, in borderline personality disorder, this splitting thing happens where you're either somebody really great or you're somebody really awful. This is not only how they judge people, this is situations. You see this polarization of how they think. It's all or nothing, it's good or bad. And as you can imagine, if you constantly are going from things are wonderful to things are horrific, then you're going to have those really strong emotional, unstable reactions. Unfortunately, something that happens with people with borderline personality disorder is they often engage in mutilation, self-mutilation, and suicide attempts. This is the personality disorder that therapists report are the most difficult. However, there is a treatment for this personality disorder that was created by a woman named Marsha Linehan. It's called dialectical behavioral therapy, or DBT. And it has shown to be really effective in treating borderline personality disorder. It's pretty intense, but it teaches people with this disorder how to take care of themselves emotionally and avoid that emotional dysregulation, that instability in terms of how they are feeling and what they're thinking, and the judgment that they make in terms of splitting. It's thought that there is a genetic link for this, but it also has been related to difficulties in early childhood. This disorder is equally common in men and women and is thought to be anywhere from 2 to 6% of the population. The next personality disorder is dependent personality disorder. And if you've watched Arrested Development, you might recognize the character on the bottom. He's someone who shows behaviors in the show that are consistent with somebody who has dependent personality disorder. And that's someone who has this extreme reliance on other people to meet their needs and to make the big decisions in life. In fact, they have this fear of being unable to care for themselves, that they're going to be alone, and then they won't be able to survive. It's characterized by being submissive, being clingy, being passive, being unable to make any decision for yourself, and an excessive need for approval because they fear that if they disagree with somebody, then they're going to be abandoned and they're going to have to try and survive on their own, and they're not going to be able to do it. This is a fairly rare disorder, less than 1%, and it's more common among women. Here's a couple other clips that can give you some more information about that. Avoidant personality disorder. This seems like it is torturous for a person to have. This is when you absolutely think that you're unlovable, that everybody is going to hate you and criticize you every chance that they get. And so fear of rejection is something that dictates their life. They need constant reassurance and uncritical acceptance from people. And one of the things that they do is they don't express their emotions because of fear that if they express their emotions, then they're going to be rejected. People have speculated that Michael Jackson might have had this personality disorder, which might have led to his relative seclusion from other people. Fictionally, if you remember Charlie Brown, if you've read any of the comics or watched any of his little cartoon specials, he really thought that nobody liked him. And he thought that was confirmed every Valentine's Day when nobody gave him Valentines. He's just a fictional example of that. People with this, they really want those relationships. They want affection from other people. They want social acceptance, but they fear that they're not lovable and that people are going to criticize them. They're going to fail. They constantly think about how whatever they're saying or thinking or doing is wrong, and people are going to judge them for it. It's a similar prevalence in men and women, and it's thought to be about less than 2%. So if you go on my website, there are some videos of people who have avoidant personality disorder, so you can get firsthand knowledge of what that is like. And it's really tragic to hear a person who has that disorder talk about what that experience is like, that fear of rejection, the fear of constant criticism and not feeling worthy of love. Obsessive-compulsive personality disorder, or OCPD. Now, this is very different from OCD, obsessive-compulsive disorder. And one of the ways that this is different is that this is one of those disorders that's often ego-syntonic. So the person who has it doesn't feel like they have any issues. In fact, they feel like it really makes their life much better, much more livable. Whereas if you have obsessive compulsive disorder, it's clearly dystonic. It clearly brings dysfunction in the people's lives who have that. They're not able to work. They're not able to attend school. Sometimes they're not even able to leave the house. So there's a very big difference between OCPD and OCD. Okay, so what does the person with OCPD have? They have this inflexibility that everything has to be done by the book, by the rules, and the rules are made by them. And they're severely judgmental of other people who don't do things the way they do. They're often workaholics. They're driven by their perfectionism. And, you'd think that this person has everything neat and clean and tidy and everything in its place, but often the person with OCPD is the hoarder, the person who can't let go of things because they have a fear or this anxiety that they're going to need it later. They are unable to delegate. Having a person like this in a group project could be heaven or hell, depending on if you want to do any work, because they might be thinking no one else can do it the way I can. And so if you wanted to participate in a group project with someone with OCPD, then you'd either be thrilled that you don't have to do anything or angry because that person totally takes control and is unable to allow anyone else to do anything on that project. Again, this is often an egosyntonic disorder where the person who has it thinks that their life is fine and it's anybody else who has the problem. If they don't do things the way that they think they should be done, then they are the ones with the problem. People with OCPD lack a sense of proportion. And what that means is there are times when you need to relax a little bit and relax the rules and make exceptions, but they don't think that. That's not something that they think is acceptable. Everything has to be done perfectly the way that they think it should be done. Now, this can actually be very adaptive for a person if they have a job that requires very precise, detailed work to be done, because it can increase your productivity in that sense, right? If you're very rigid and rule-following and scheduled, it can be a good thing for them. Not for everyone else, but for them. Again, this is not the same as OCD. I just want to make sure I make that distinction. OCPD is something that the person thinks they're doing just fine with, whereas OCD, the person with OCD is clearly suffering as a result of that anxiety disorder. It's thought that Monica Geller, this is a fictional portrayal, but Monica Geller showed some signs of OCPD. So it's thought that Steve Jobs, over here in the bottom right corner, might have been somebody who had OCPD, and that might have been one of the reasons why he was so successful. He's the reason why we have the iPhone. And so his OCPD might have led to his ability to be productive and generate things like the iPhone. Okay, if we think about personality and personality disorders in terms of you either have one or you don't, we're really classifying people as you're either normal or you're abnormal. But maybe that's not really the way that it works. If we think about personality as being dimensional, personality characteristics are normally distributed in the population. There's going to be most people who are somewhere in the middle for any particular trait, but there's also going to be some smaller amount of people that are on either end. This little infographic here on the right gives an interesting way of thinking about it. So let's think about in terms of schizoid. Remember, these are people who are void of any desire for social interaction versus the histrionic. Remember, they always want to be the center of attention with people. You can think about this as being on a dimension, the gregarious extroverted dimension on one end, and on the other is the aloof or introverted dimension. So most people, of course, are going to be somewhere in the middle here, in the mean of the curve, but it's the people that are on the very edges that would qualify as having a personality disorder. And so you can think about the different personality disorders portrayed here as being those far edges, those extremes of each of these dimensions. What that tells us is that there really is not a sharp dividing line between what is considered normal and what's considered abnormal. And so that idea of using a typology to separate histrionic from schizoid may not be accurate. That and the fact that there's a comorbidity issue, whereas if you have one personality disorder, it's possible and probably likely that you may qualify as having another. There is definitely overlap between these personality disorders too. Now, also, being extroverted and gregarious is something that our culture thinks is a great thing. And so you may have some of the characteristics of somebody who has histrionic personality disorder, but you may not meet the criteria. And that doesn't mean that you're disordered either. It just may mean that you're very confident and you are very comfortable performing in front of people. So even if you have some of the characteristics of a personality disorder, maybe you fall farther on this end of the continuum, that doesn't make you disordered. Those are things that we need to keep in mind and consider. Another thing is that we may have these buckets for what we qualify people or classify people as personality disordered, but that depends on the culture that they live in, because every culture is going to have slightly different ideas of what is acceptable behavior. And that also depends, again, as I mentioned before, on the temporal context. So things that are appropriate behavior currently might not have been considered to be appropriate 50 years ago, and things that 50 years ago were totally appropriate in a culture, now that behavior would look very disordered. So our ideas of what's normal and abnormal, there are not very clear dividing lines at all. Is it useful to label people with a personality disorder? Sometimes those labels can be misleading, particularly with disorders like borderline personality disorder, where two people with an identical diagnosis of BPD might look very, very different if you looked at their symptomology and their behavior. Labeling someone and putting them in a category can also limit us from getting a better understanding of what their symptomology is and understanding what led into that person's behavior, their background. It might decrease our empathy because if we just classify somebody as having a disorder, in our minds we may think, oh, that person is disordered, so I can't really work with them or I can't understand them. It might limit our ability to have empathy for them. And also, personality disorders don't explain why a person is behaving in that way. So are they really helpful? Well, I think people would say yes, they are helpful because they can have some objectivity from one clinician to the next. If you have a diagnosis of a personality disorder, that immediately gives a clinician a better idea of what they're dealing with. And also, it allows them to have a way to communicate with insurance companies so that they can get paid for treatment. They are useful too in being able to do research on the different personality disorders. If you have a general classification for similar behaviors, then that allows a better investigation of the things that might lead into somebody having that disorder, and also being able to talk about the disorders with more precision.